Hi, welcome everyone. My name is Michelle Hart. I'm the Director of Marketing and Communications at BostonSight. I want to thank you for joining us this evening. I'm going to start off by sharing a brief overview of BostonSight and introducing our panelists. I'll also share what you can expect from this webinar. Just a reminder to our panelists, if you are not speaking, keep yourself on mute. Thank you. Okay, BostonSight was founded in 1992 as Boston Foundation for Sight. Here in Needham, Massachusetts, our site, there is an on-site clinic, a research team, and an ISO certified manufacturing lab. We also have an education team. Our vision is a world where no one suffers loss of sight from corneal irregularities or ocular surface disease. And the mission of BostonSight is to improve quality of life by transforming the understanding, treatment, and care of the ocular surface. We work to do this with patients, caregivers, and practitioners. We share our research and our care models so that everyone who needs a specialty lens, whether it's a PROSE device or a scleral lens, has access to the best technology and care. Tonight we're going to have a Q&A at the end. So as we go through this webinar, if you think of questions or if you would like to hear more about something that we have not covered or more about a particular topic, please type them into the Q&A box. At the end, I'll ask our presenters the questions. And if we don't have time to respond to all of the questions, we will be following up to everybody who registered for the webinar with a recording and answers to those questions. So let's introduce our presenters tonight. We have Dr. Daniel Brox. He is our BostonSight Chief Medical Officer. Dr. Brox is a certified comprehensive ophthalmologist, and he specializes in the treatment of the cornea and external diseases. He received his BA and medical degree from Tufts University. He completed his internal medicine internship at Mount Auburn Hospital and Harvard University. He completed his ophthalmology residency at Long Island Jewish North Shore Hospital System in Long Island. And Dr. Brox completed an additional fellowship year of training at Mount Sinai Medical Center in Manhattan. There he studied the medical and surgical treatment of the cornea under one of the world's leading corneal surgeons, Dr. Penny Asbell. Darlene Riordan is the Director of Clinical Operations at BostonSight and a certified ophthalmic technician. She is also a certified ophthalmic executive, which is the national standard for ophthalmic practice management. The COE program recognizes those who have achieved the experience, knowledge, and skills identified by the national board as essential to practice management. Darlene manages all clinic staff and operations at BostonSight Needham. Kinney is our patient representative tonight. He has been a BostonSight PROSE patient for nearly 20 years, and he'll speak about his experience with Sjogren's syndrome. So we're going to have Dr. Brox talk about what PROSE treatment is, its clinical indications. Kinney will share his personal experience with PROSE, how he discovered the treatment, the process, and his life today. And Darlene will provide information about PROSE referrals, the treatment and intake process, and PROSE locations. As I mentioned, we'll end with a question and answer session. So again, welcome to all of our presenters and welcome to all of you tuning in. Let's get started. All right, Dr. Brox, I'm going to hand control over to you and you can take it away.
All right, thank you. You can hear me okay?
Yes, we can hear you. Thank you.
All right. See if I can advance. There we go. All right, so we're just going to start off today by talking about what PROSE treatment is, and thanks for taking the time to listen to us and hear about PROSE, what we feel is a very important treatment for many ophthalmic diseases. PROSE really does stand for prosthetic replacement of the ocular surface ecosystem, and it's really a treatment process. So we consider it a comprehensive medical treatment that includes a corneal specialist, ophthalmologist, and an optometrist that's been fellowship trained in PROSE treatments, working together to provide care for specific ocular surface and corneal diseases. The PROSE doctors always are working in combination with your local specialists. This can include other eye care professionals or other medical specialists, primary medical care providers, in order to optimize the care for the particular disease or condition that we're treating. So what are PROSE devices? PROSE devices are these removable transparent domes about the size of a nickel, generally speaking, and they're made of a gas permeable plastic so that oxygen can move through the plastic and still get to the eye to preserve the health of your eye with enough oxygen each day. The devices rest, importantly, not on the cornea itself like most contact lenses, but rather on the white part of the eye, the sclera, and they vault over the cornea tissue, which I'll show you an image of shortly. That creates a smooth surface over what may be a diseased or damaged cornea. Each morning, these lenses are filled with preservative-free saline and then applied to the eye. They're removed before sleep. We never sleep in these lenses. And each day that process is repeated. They're disinfected each night, overnight. These PROSE devices are cleared by the FDA for therapeutic indications for treating ocular surface and corneal diseases. So the PROSE device and the anatomy that we treat is important here. On the left side of the screen, you can see an actual PROSE device on the eye. You can see the edge of the lens, and it's resting right on the white part of the eye. Then it vaults over the cornea. The cornea is the clear tissue that's covering the colored part of the eye, in this case, the brown eye. If you look at the diagram on the right, you can more clearly see a side view here where we see the lens itself is this dark blue covering. Then you see the light blue, which is actually the liquid reservoir. So that's the preservative-free normal saline that goes in the lens every morning and is applied to the eye. And then the cornea. So you're basically creating this liquid reservoir between the cornea and the lens itself, which is what the treatment is doing for the eye. So how does this setup help? How does that liquid reservoir help you throughout the day? Well, it really achieves three things. One, what we call ocular surface support. So take someone that has dry eye or a breakdown of the surface of the eye. It provides a nourishing environment where it's constantly being lubricated all day long, every day while the lens is on the eye. Doing that as well provides comfort to the eye. Having a degraded or rough cornea or diseased cornea is extremely painful typically, and having that covering the liquid reservoir over it can provide pain relief. And by doing this setup with the lens and the liquid reservoir, we can actually significantly improve vision for patients with corneal diseases. So those three indications are typically what we're talking about, regardless of the disease: supporting the surface of the eye, providing comfort, and improving vision. So sometimes the terminology gets a little confusing. We're talking about PROSE today, but we have a similar sister treatment, which is called scleral lenses. And there's some differences that are worth noting. And generally, it's about the complexity of the disease and the severity of the disease that we're treating. When we're talking about the PROSE lens, we're talking about something that can be customized as much as the doctor could possibly need in order to treat that patient properly. Scleral lenses are lenses that also sit on the white part of the eye and vault over the cornea, but there's more limited options of customization. So when we have more severe disease, typically a PROSE device is necessary. When we have more complicated disease, typically a PROSE device and PROSE treatment is necessary in order to treat properly, to optimize the care, and to coordinate that care properly with all their physicians. For more simplified disease states, or less complex, we can go to a scleral lens, which is more of an out-of-the-box treatment with less customization, but still very helpful for those with mild to moderate disease. So we split it up here just more clearly between scleral lenses and PROSE treatments. And as you can see, I mentioned, the scleral lenses are more for mild to moderate disease states, and little less customization available for these types of lenses. Fellowship training of the optometrist and an ophthalmologist are not necessarily required for these types of lenses. For PROSE treatment, we're talking about a fully customized lens that can be adjusted in any way necessary. And as already discussed, we have an ophthalmologist and a fellowship trained optometrist, lots of co-management going on, and generally for these more complex diseases. So I always like to show this slide because I think that other stuff is a lot of words and hopefully makes some sense as we're introduced to things. And as you hear it again and again, it makes a little more sense. But this slide shows you the significant difference that can occur between a PROSE lens on the left and a scleral lens on the right. For a typical dry eye patient that is a more mild to moderate case, you may be able to have great success with a scleral lens like you see on the right. Less customization. This particular lens doesn't have as large a diameter or as high as a reservoir. But on the left, you can see this was for a patient that required PROSE treatment and a PROSE device where they had a very irregular cornea requiring a very steep reservoir and a larger diameter lens that was customized in every way possible to fit that particular patient who had very severe irregular cornea. So what about efficacy? In other words, how well does it work? Well, this is a survey of 2,000 PROSE patients, and this is the percentage of respondents that said it improved the quality of their life. So 96% of those respondents to the survey said that the PROSE treatment improved the quality of their life. And 95% said it improved their vision and eye health. But here's where we run into a little bit of trouble is that 62% said they waited 3+ years for a referral. So in those 3+ years, they were struggling with other treatments that were not working for them or not working enough for them. And that's why they, of course, ended up in our clinic. But we do webinars and seminars like this to educate doctors and to educate patients about what we do. So hopefully they don't need to be suffering with that pain or that discomfort or having their eye health be reduced for years until they find that PROSE treatments are available for them. So we hope to obviously improve upon that number so people don't have to wait so long for a referral to receive PROSE treatment. So this is just broken down by different disease states in terms of how respondents said it improved their eye health and vision to get PROSE treatment. And you can see the various percentages that the respondents gave in each particular disease state. And this is one of the reasons that I got into PROSE treatments because it is quite efficacious for the appropriate patients. It can make such a significant difference for their comfort, for their vision, and just for their activities of daily life and for their well-being. So for one of the patients that's been treated by PROSE, we want to introduce you to is Kinney. And Kinney has a condition called Sjogren's syndrome, which I'm sure some are familiar with. But Sjogren's syndrome is a systemic autoimmune disease that affects the entire body. Here, of course, we're talking mostly about how the eyes are affected. And when we have autoimmune diseases, that means our body, for some reason, is not recognizing tissue as our own and starts to attack it with our immune system. And so in this case, one of the things that happens at Sjogren's is that the immune system attacks the lacrimal gland, which is a gland that produces our tears. So when that gland is damaged, we no longer are producing enough or sometimes any tears to lubricate our eye and result in a very severe form of dry eye, which can result in extreme pain and deteriorating vision. There's a lot of other treatments that can be tried, but many patients end up in our chair because they don't find enough comfort or improvement in vision from the other treatments that are available. So I'll hand it off to Kinney to further discuss his experience.
Yes, thank you. So Kinney, I'm going to unmute you so that you can share your experience. Let's make sure you're unmuted here. There we go.
There we go. Okay.
There, and these questions are up here, Kinney, just to help provide some guidance. But yes, please start with how you were diagnosed and how Sjogren's affects your life.
All right. Well, so in 2000, I was diagnosed with rheumatoid arthritis.
Oops.
And I went to a lot of different doctors, and they all said they could manage my condition, but they couldn't help me. And then my brother sent me to the wife of his partner. My brother's a cardiologist. She's a rheumatologist, and she had just finished her all of her clinical practices, and she had run the clinical trials for all the new RA drugs. And so where these other doctors said they couldn't help me, she said, if I don't get you in remission, you'll be my first patient that I don't get in remission. And from that, I learned that even though people are doctors and they're well-meaning, and that not all of them know all the latest things. So when I started having trouble with my eyes, I would be reading, and my eyes would lock in on the close vision, and I couldn't see far away. And so I went to lots of different eye doctors. I mean, we traveled 3-4 hours one way to try to find specialists, and nobody ever told me I had dry eye syndrome. Uh, they all tried to treat me using some different eye drops, including prescription eye drops, that nothing helped. My vision just kept getting worse and worse and worse, and the pain got worse and worse until I could still see the road, the streets when I was driving, but I couldn't see the cars when I was driving. So I had to give up driving. And I was in constant pain from the moment I got up till the moment I went to sleep at night. But I didn't give up. I just kept going to try to find more and more specialists, hoping that I could eventually find one who knew something. And I finally found this eye specialist in Fort Worth. And he said, it looks like somebody has been working on your corneas with a Brillo pad. They're just all scratched up. That was from I had no tears. They did one of those tests where they see how much tears you make, and I had 0. And he said, there's really not much I can do for you. And then he left the room. And then as I was gathering my stuff to leave, he walked back and he said, you might try contacting Boston Foundation. They can help you. So I contacted Boston Foundation. I found them on the internet. We sent them an email. And my wife and I were living in Russia at the time. So we made an appointment. We came back from Russia to Boston. And when I walked in the doctor's office, the first thing they did was they dimmed the lights. And because of the Sjogren's, the dry eye syndrome, my eyes were very light sensitive. And when they did that, I thought, maybe they can help me. And it was actually from the doctors there at Boston Foundation that I learned I had dry eye syndrome. And then it was a little while after that I was officially diagnosed with Sjogren's. So it was just sort of an accident that I found out about Boston Foundation and got there. So I'm a teacher. I teach Bible. I guess you'd call me a professor of Bible. So I have to do a lot of studying. And because of my Sjogren's, I had lost the ability to read. I could no longer even see the big E on the eye chart. My vision had gotten really, really bad. And so I decided to go to PROSE because it was my last hope. I didn't know if it'd work or not, but I was willing to take a chance to get out of that constant pain and then hopefully be able to improve my vision. I was pleasantly surprised when the doctors there at Boston told me that they were going to be able to make me to see better. I would have been just tickled to death if they could have taken away the pain, but they actually got my vision back to 2020. My fitting process went fairly well. They got my left lens perfect on, I think, the second lens they made. The right lens took them a little longer, so it took, I went into the second week of treatment. And the second they put the first lens in, it was the first time I hadn't had eye pain in years and years and years. So for me, the pain relief was immediately, and the ability to see was immediately. In fact, I was able to return to driving while I was there in Boston, even before they got the last lens fixed the way that they wanted to. For me, the learning to apply and remove the devices was more difficult because I can't see anything up close. And I couldn't see the lens. I couldn't see the little applicator that you use. So I was having to go by feel. But then one of the ladies that was helping me to learn how to do it suggested I try this green light. And I could see that green light, and with that green light, I could then guide that into my eye. And then from then on out, I didn't have any trouble at all. So how has my condition changed? I can do everything now that I couldn't do before. And I have no pain. I can read, I can drive, I can do everything. And so going to Boston Foundation was absolutely life-changing and life-transforming for me. The people in Boston were exceedingly helpful with arranging my first visit. We had to do all our correspondence through email because since I was in Russia, we couldn't call on the phone. And they did everything to make it where I could come to Boston and get my lenses. And I've been back many, many times, and every time they're super nice, super professional. And I have sent several of my friends to you, people that I've met that needed PROSE lenses, that were going through that same process of a lot of pain, losing their ability to see, and they couldn't find a doctor in our part of the world that could help them. And the ones that went to Boston were able to get fitted and found relief. So I tell everybody I know, including doctors, about Boston Foundation, trying to help them to learn that there are solutions out there for people with my kind of problem. Thank you.
Thank you, Kenny. Some people might be wondering why you're wearing eyeglasses tonight.
Because I do a lot of work on the computer, and so I have my no line bifocals in my glasses. The glass part on the top is no corrections, just the no line bifocals. And the glasses also provide me a little protection from like ceiling fans and wind and that kind of stuff.
Makes sense.
My grandkids like to go with me to watch football, and when the wind's blowing while I'm watching football, if I don't have the glasses on, then it's not super comfortable.
Understood. Okay, thank you. I'm sure we'll have some questions for you in a little bit. But I'm going to move on to Darlene, our Director of Clinic Operations. I'm going to hand her control in just a moment. All right. Welcome, Darlene. You'll just need to unmute yourself.
Be helpful. Thank you, Michelle. Hello, everybody. As we learned, as Dr. Brox had mentioned a few minutes ago, 62% of PROSE patients are waiting 3 years or more for a referral. And I want to talk a little bit about how you can advocate for yourself. And there we go. Okay, sorry, I was having a little problem. Anyway, I want to talk a little bit how to advocate for yourself. Certainly, you can request a referral from your primary eye care provider or corneal specialist. If they are unfamiliar with PROSE treatment, please request that they view our website and see what conditions PROSE treatment is beneficial for. If they would like to speak with us, we do have a separate line dedicated to medical professionals, as well as a referral hotline for urgent referrals. And if your provider is reluctant to refer you for whatever reason, you may reach out to us directly by calling our main line or emailing scheduling at bostonsight.org to contact an intake coordinator. Next, I want to talk a little bit about the referral process. Typically, patients are referred to us by their primary eye care provider or their corneal specialist. Occasionally, they're referred by another medical doctor, such as their oncologist or maybe even their rheumatologist. We have some patients that are self-referred after a Google search for information on their diagnosis, or a Facebook group for people with their condition as well. And then others find their way to us through recommendations from other patients, family members, or friends. If a patient is referred by a medical provider, we do have a PROSE new patient referral form that's shown there on this slide, which can be completed and faxed to our office. The form is not required, but it does give us a nice snapshot of the eye condition, of the patient's condition, and the previous treatments they have already tried. Let's see, I'm trying to get to the next. Oh, there we go. Okay. Once that initial contact is made, whether it's by a patient or a provider, the patient is sent an intake packet to complete. We require demographic and insurance information along with medical forms to collect medical and ocular history, past surgeries, and current medications. And our ocular history form is tailored to collect the past treatments the patient has had for their particular eye conditions that we would be treating for. We also require a recent eye exam from their primary eye care provider or corneal specialist, usually within the past 6 months. And once we receive all the completed forms, along with the exam notes, the patient's packet then goes to medical review. And for medical review, I want to explain a little bit about that. Every new patient is screened prior to scheduling a consultation. And Dr. Brox or I will review the completed intake forms and eye exam notes to ensure a PROSE consultation would be appropriate for that patient's diagnosis. For a patient with corneal surface irregularities, such as keratoconus, we're typically looking for a failure with a hard lens. Dr. Brock spoke quite a bit about, PROSE lenses or scleral lenses, but there are a smaller type rigid cast permeable lens, typically known as an RGP. That particular lens would rest right on the cornea. And for patients with some corneal irregularities, sometimes it just won't fit. It can pop out, and so making that not a valid option. Some patients also use what they call a hybrid lens, which is that rigid gas permeable lens in the center, but a soft lens as a skirt. And that can be more comfortable, and they might not pop out, such as a RGP, a lens alone might, but the vision's more likely to fluctuate, and they might not be ideal for someone that suffers from dry eye. Some of our patients that come in, they have been unsuccessful with a commercial scleral lens, and due to poor comfort or vision, occasionally a hard lens failure isn't required due to the severity of the patient's disease. For patients with ocular surface disease, we're looking to see that they have not responded to other dry eye treatments, such as lubricating drops and ointments, plugs, immunosuppressant medications such as Restasis or Cequa and Xiidra, or eye drops made from the patient's own blood serum. And the purpose of looking at these past medical treatments is to provide the medical necessity required by some insurance companies. PROSE treatment is expensive, and many insurance companies will cover it at least partially if other treatment options have been exhausted. And during the medical review, contraindications such as baseline corneal edema or swelling, topical steroid use multiple times a day, and the existence or location of tube shunts from previous glaucoma surgeries are considered. Also, the duration of the visit is determined for patients that will be traveling from far away and staying at a local hotel during treatment. And most patients can expect treatment to take approximately 1 week. But some patients must commit to a 2-week visit, and occasionally challenging cases require the patient to return for additional multi-day visits. And if the patient is determined to be a candidate for PROSE treatment, the record will then go to our insurance department for review. Our patient insurance coordinator will contact the patient's insurance company to obtain a quote for coverage. That quote will then be reviewed by the patient. If the patient does not have coverage or possibly only partial coverage, payment options, including an interest-free payment plan or the opportunity to apply for financial aid, will be discussed. And a financial assistance application will be sent by email or regular mail if the patient would like to apply. And once that financial assistance application is completed and submitted by the patient with all the supporting documents, it will be reviewed by our finance department, and the patient will be contacted for assistance eligibility. And patients approved for 100% financial assistance will be eligible for partial reimbursement for their hotel, for travel, and for food during their treatment through our BostonSight Family Fund. And I want to talk a little bit about now what your experience would be like if you do come to us for treatment, because patients can be at our clinic for several days. Usually treatment is completed within 4 to 5 days, but it can take 10 days or more. Patients will start with a consultation on day 1 to see if they're a candidate for PROSE treatment. If they are, and they wish to proceed, their PROSE treatment will start at the next visit. The day of the start treatment begins with their provider applying their first set of customized PROSE devices. And the next appointment, it's called the PROSE assessment, follows generally about 2 to 3 hours later, when the provider will evaluate how the device is fitting and how the patient is tolerating the device. At that point, the doctor will design and order another device or devices, if needed, for the following day, while their patient then goes into training to learn how to apply and remove their devices with one of our technicians. Day 3 and beyond, we'll have a morning appointment with the doctor, generally followed by training again with the technician, and a 2 to 3 hour gap before they see the doctor again for that PROSE assessment that I discussed a couple minutes ago. And that process will continue until the patient has been dispensed, because they are doing great at applying and removing their devices and they do not need any additional training. And also the doctor has reached that endpoint as well for their final devices. While patients are waiting in between their appointments, we do have a couple of different waiting areas. They can also take a short walk or to get something to eat or do a little shopping. And our patients travel from across the United States, and occasionally we have an international patient, but most patients seen at our site in Needham are from New England, New York, or New Jersey. And for patients traveling from a distance, BostonSight has contracts with local hotels to help provide the patients with the best possible room rates. Enterprise Rent-A-Car does provide a small discount with advanced reservations for car rental as well. I spoke a little bit on the last slide about the training by the technicians, and I just want to talk a little bit, go in a little bit more in depth in that. The first visit, the first training, it begins with the patient viewing videos on how to apply and remove a device. They're given a copy of our PROSE guide, which reviews all aspects of application, removal, solutions, and storage. Some patients have never used any type of contact lens, and the PROSE devices, as Dr. Brock showed you, can be quite large, and for many patients can be intimidating. However, our seasoned technicians, we've helped hundreds, possibly even thousands of patients conquer those challenges, such as being able to keep their lids open wide enough to apply their device due to small lids, or overcoming a strong blink reflex. A plunger stand can hold the device while allowing the patient to use two hands to help keep their eyes open, which can be a game changer. And then challenges with fixating on the device due to poor vision can be improved using a light for guidance, which Kenny had discussed using during his training. Each training, it takes up to 45 minutes. Patients can have up to 2 a day until they're confident and capable of applying and removing their devices. As Dr. Brox mentioned, the devices must be removed daily. Patients are instructed on solutions for cleaning and overnight disinfection, as well as the appropriate solutions to rinse and fill their devices. When patients complete their training, they receive discharge instructions to advise them to follow up with their primary eye care provider within 2 to 3 weeks of dispensing. They also remind patients they must continue to see their regular eye doctor. BostonSight does not provide comprehensive eye care. And we also request that the patients return to us every 1 to 2 years or sooner if the doctor advises for annual PROSE evaluations to ensure the devices are still fitting properly. Prior to departure with the patient, with their devices, patients are provided with our triage phone number and email address for any questions that may arise. And as shown on the screen, there are PROSE application and removal videos that are available online to review at any time. The PROSE device use and care guide that I mentioned, patients get at their first visit. It's also available on our website, and it provides the links to purchase the solutions. And our homepage, our BostonSight homepage, alerts patients to any solution shortages or recalls so that they may be aware of that as well. During the initial phone call with a prospective patient, the option to see a PROSE provider in a location closer to the patient will be offered, if there is one. Right now we have 15 network sites at tertiary eye care centers in the United States, Canada, and India. The PROSE providers, at these sites are all PROSE fellowship trained eye doctors. Each PROSE network site is independently managed, and the cost for treatment varies at each location as well as insurance coverage due to contractual agreements with individual insurance companies. And all orders for PROSE network providers, except for India, are manufactured here in our Needham, Mass location. I did say except for India, they also have a manufacturing lab at that PROSE site. Once an order is submitted to us, the device is manufactured and shipped overnight by FedEx to these provider networks. Although our Needham, Massachusetts location may not be the closest location for some patients, it can sometimes be the best option to expedite the treatment process. With our on-site manufacturing lab, device orders submitted by our treating providers are typically completed and back out in our clinic within 2 hours, which can allow the providers at our office to have several devices made for a patient in a single day, and the treatment to be completed faster. Although the process may be a little different at the network sites, you can still expect to receive expert, compassionate care at all PROSE locations. And if you're struggling with your vision and eye comfort, you can find a PROSE provider at our website, and you can reach out to them directly for more information. Thank you.
Thank you, Darlene. Yes, you can find a PROSE provider at our website at bostonsight.org/find-a-provider. The website is listed there at the bottom of the screen. Before we get to the Q&A, I just wanted to share 2 quotes from some of our PROSE patients. These are not, if you happen to join us for our last webinar, these are actually different quotes. We have hundreds of quotes from patients who have wonderful things to say. This patient said, "Were it not for PROSE and BostonSight, I would not be able to see almost anything. Prior to coming, my vision had gotten to the point I could barely see." And this was also after I'd had a corneal transplant some years prior. PROSE significantly improved my life. I am very grateful and do not know what I would do without you. Thank you. And this next one is interesting because the patient was an ophthalmologist. Without the PROSE lens, I would no longer be working as an ophthalmologist. Surgery would be impossible. Thank you for everything. So I'm going to stop sharing our presentation. But again, if you have questions, please type them in the chat box or in the Q&A, and we're going to get to those questions now. Oops. There we go. Okay. This first question is for Kenny. What year did he have his first appointment with Boston Foundation?
Hey, I'm pretty sure it was either 2007 or 2008.
Thank you. And then Chris asked, I think Darlene just mentioned a treatment challenge for dry eye patients. Can you repeat what she said? Do you recall that, Darlene?
Not specifically a treatment challenge. Patients come to see us when they've not had success with other dry eye treatments. They might be using multiple treatments. And then they come to us because they're still suffering. One thing that we do know that for training, patients can certainly be a little bit more challenged. When your eye is so dry and we're asking you to open your eye quite big in order to apply the devices, our dry eye patients can certainly be challenged. We definitely have some tips and tricks that the technicians have picked up along the way that can help make that process much easier. I hope that answers the question.
Chris, if you have additional follow-up, please either type in the Q&A or follow up with us via email. There's a question about cost. Does it vary from site to site?
Yes, it absolutely does. Each network site sets their own pricing. And so I couldn't tell you what any other office does charge, but yes, it is different depending on where you go.
Thank you. The question about meibomian gland drop-off. How do I know which lens would be best? And I think Dr. Brox also had answered another question. Can patients with total meibomian gland dropout be candidates for scleral lenses? So kind of a combination, that question along with is a PROSE or scleral lens preferable?
Sure. Right. So a meibomian gland drop-off or dropout is a particular type of problem that can lead to dry eye disease. There's little glands on the edge of our eyelids that make part of our tears. So for many people, these glands not working properly or not working at all can result in dry eye. So it's one of the types of dry eye disease, and certainly there's no exclusion for those patients. They can certainly benefit from and be treated with PROSE for any disease state, sometimes things in combination with PROSE, sometimes PROSE alone. For each case, of course, we optimize the care accordingly, but that is a disease state that we regularly treat, yes.
Have you had many patients with severe dry eye disease who were unable to be fitted comfortably with scleral lenses find instead success with PROSE?
Yes, so that's a very good question. So we get a lot of referrals. A subset of our referrals are patients that have previously tried scleral lenses for any type of ocular surface disease, including dry eye disease, who have not had success and then come to see us. So generally speaking, we have good success with these patients, and that's those percentages that I showed you before. Some of those patients that were successful were people that previously tried scleral lenses, some had not. But a lot of these patients that come to us that previously had scleral lenses that had difficulty with it and are successful with PROSE, it's because there's certain customizations that are needed to make the lens comfortable for them, whether it be the diameter or the size or shape that we're able to do that makes them comfortable. Or I will say that for a lot of these patients in just a general eye care setting, they're not afforded the amount of time they need for the training in order to get comfortable or even to find a method to successfully apply and remove the lenses. So we'll generally, as Kinney was so nicely reviewing, we'll spend many hours with patients for training to find the exact technique that matches up best for them to be successful. Some patients need 2 45-minute sessions to be trained on application removal. Some patients need 5 or 6 hours to feel very comfortable or more. So some of those referrals of scleral lens patients are that they just have struggled in for months or sometimes even years in getting the lens in their eye and just have forgotten about it or not been successful. So we customize it to optimize it as best as possible as far as the fit goes, but then spend extensive time on the fitting. I'm sorry, on the training and on the application and removal.
Thank you. For you again, Dan, how do you decide between scleral lenses and PROSE?
Yes. So, in those slides, I tried to map out what generally our ideas are. When a patient wants to come to see us for PROSE treatment, as Darlene mentioned, she or I or both of us will do a medical review of the case. That means we're getting all your records, looking at all the measurements, looking at pictures, whatever we can get our hands on to determine what's best for you. So sometimes it's very obvious from this disease state how severe it is or what treatments have been tried before that PROSE is the right option. Sometimes it requires me making a phone call even before we've met you in the clinic to discuss your case a little more. Sometimes we have to get more information, but we will call you and tell you, oh, we think X, Y, or Z is better first if that is the case. Or if we can't tell from that data, we'll have to tell you that we'll have to figure that out when we see you to tell you what's best for you. So it's based upon the disease state, the severity, the complexity, whether you need that degree of customization and care, or whether scleral lens or other treatment is more appropriate for you. And that's certainly one of the things I think hopefully Kinney felt that when he was here, when he started until he's gone through all these years with us, and Darlene and everyone at our office wants you to get what is going to be best for you. And if it is PROSE, that's great. And we feel proud to have helped so many people. If it's something else that's more appropriate first, we'll certainly review that with you and get you pushed in the right direction.
This is for Darlene. Sharon said she had to stop wearing contacts. Her eyes are small and she had a tough time applying them. Would this be the same issue with PROSE devices?
Certainly, patients with small lid apertures, it can be more challenging to apply and remove devices. But I can't say that has stopped our patients. Our technicians are truly amazing. I don't really think that there's anything they haven't encountered. And, not only have we learned from each other, we've learned from all of our patients along the way, what's worked and what hasn't. And I can just tell you that we will guide you. We don't give up easily at all. I can tell you we had one patient, local, thank goodness. We trained her 53 times before, we had 53 training sessions with her before she was able to be dispensed. we will work with you and we will get you there.
I will say, just to add to that, I'm assuming that this attendee meant that they had tried soft contact lenses and were having trouble with that. It's sometimes counterintuitive. The rigid material, the hard lens, if you will, or the material is hard that we're talking about, it maintains its shape. So many people are surprised that it's actually easier. I'm not saying easy for everyone, but easier to apply a rigid plastic material because it maintains its shape. It's not going to fold over, or you're not going to squeeze it out. It's not going to fall out of the eye. Once it's in, it's in. And its placement and application is easier in some ways than a soft contact lens, particularly for people that have lid anatomy challenges or things like that. So it takes, as our Darlene said, it takes a varying amount of time for different people to learn. Does every human being we see always result in success? Of course not. But we have, like we showed you, high percentages of success, and we're proud of that. And as Darlene said, I think what really underscores it is we don't give up easily. When I first came here about 7, 8 years ago, I was shocked to see the patients that were successful and how much these trainers don't give up, and that they're able to get patients to be successful in something they didn't even imagine they would be able to do. So certainly 53 is a high water mark. So we're not going to see everyone. I don't
Very
want
high.
everyone to worry that we're seeing you 53 times. But the point is, like Darlene said, we're willing to do as much time as you need or you feel you're willing to take to be successful.
Thank you. Does wearing time decrease with your lenses after a cornea transplant?
That's a great question, very specific. With transplants, it can, or with any particular type of cornea condition, sometimes we do what's called limited wear, meaning we do our fitting, our evaluation, and we find that the cornea can tolerate only a certain number of hours of wear a day. So we sometimes prescribe to people no more than 5 hours a day, no more than 8 hours a day, or something of that nature. If we took all the patients that have a limited wear prescription, probably many of those are people that have had transplants. There's plenty of people that have transplants that have no limitation to wear hours, but people with transplants can have a limited wear time that we prescribe for them, which is part of the process to determine what number of hours per day is acceptable for the health of your eyes.
That individual actually also had a second part. Does comfort and wearing time decrease with age as well?
I don't think there's a direct correlation there. No, I don't think that's something we see. I could understand how that could be something maybe one would expect, but not really a correlation there between comfort and age or wearing time and age. It's more dependent on the disease state. And a good example of people that have had transplants. We have people coming in that have had a transplant 40 years ago and is still wearing a lens as many hours they want a day. And we have other people that had a transplant 4 years ago and their wear is limited. So it's more based on the disease state, the condition of the eye.
Can PROSE lenses correct vision so that prescription glasses are no longer necessary?
All good questions. So most of our patients are, of course, in the PROSE lens, not just to get out of glasses, of course, not that that's a bad thing, but for patients, traditionally we'll put in their distance prescription into the PROSE lens. That is our standard way of going about things. And then people that need reading glasses will still need reading glasses, of course. Sometimes we get a little fancy and we do what's called monovision, where one eye is distance and one eye is near. And occasionally we'll have a patient that wants the lenses to be their near prescription and to put on glasses when they want to see in the distance. So there are options there, and stay tuned. Perhaps in the near-ish future, we'll have like a multifocal lens, which is more like a progressive eyeglass, which tries to give you a little bit of distance and near vision. But there's choices, of course, to be made there as you work with the doctor about what exact prescription you want in your lens.
Thank you. This is probably for Darlene. Is there an average amount of time the devices last? And if they're starting to be cloudy throughout the day, or you have to keep removing them to clean them, might that be a sign of age of the lens? How often might they need to be replaced?
This might actually be a question for Dan. I can certainly say that there is no exact time, expiration of lenses, although 4 years is a considerable amount of time to have a particular lens. But I will let Dan answer from here. I think he'd give a more
I don't think so.
complete answer.
Yeah, so generally when patients get the lenses, we say they will last a year to 2 years, but it depends on a lot of things. It depends on the wear time, the care of the lens. Also, it depends on things you may not think about, the occupational conditions. We have patients that are in construction, for instance, and a lot of debris and things in the air all day long. That scratches up the surface of the lens, and they may like clockwork on the 1 year mark need new lenses. As we have, on the other extreme, we certainly have patients coming in that have had the same lens for 5, 10 years, and they are performing very well for them. So it's a little bit less predictable when you get into those more years about how long it'll last for each patient. But there are some variables you can control, like properly wearing, caring, disinfecting, and these sorts of things. We can, in some cases, recondition lenses. In other words, if some of the coatings are coming off or getting some superficial scratches, the engineering lab can sometimes recondition lenses to improve them for longer length of wear. But for each lens, of course, we have to evaluate and determine what's best for it.
Thank you. This one is about oxygen permeability. So Theodore had tried sclerals back in around 2004 and having some corneal edema due to lack of oxygen. Are the lenses today, do they have better oxygen permeability?
Yes. So when it first started, scleral lenses, they were actually made of glass, and the oxygen permeability of glass lenses is 0. And so they saw quickly that was not a winner. Patients could wear them, for a couple of weeks, and they started getting problems with their cornea, whether it be scarring or swelling and these sorts of things you're talking about. So with transplants in particular, but all cornea diseases, really, we want to be very careful that the cornea is getting enough oxygen. Some require higher levels of oxygen than others. But over the years, just like we used to use glass, and then came plastic, and then gas permeable plastic, and the gas permeability of these materials through experiments and research and all these things, they develop new materials all the time. And so every couple of years come out with a new material. So since 2004, I think you said, there certainly are materials with higher, what we call DK is the terminology in ophthalmology, but that just is the number we use to measure oxygen permeability. And they're quite a bit higher now than they were in 2004.
Okay, I know we're running out of time. I'm going to ask one more question. I know there's more questions in the Q&A. We will write up responses to all of those and email all of you so that we want to make sure your questions are answered. So the next one was, if a PROSE lens doesn't fit, do you reuse the lens
Oh, I'm sorry. I just
I keep
answered
moving.
that.
Is that you? Oh, are you answering?
That was me. I was typing that one out. I'm sorry, I found it. It's just the question was, if a PROSE lens doesn't fit, do you reuse the lens to retrofit, or do you use another? I had the PROSE done 13 years ago. And so each time it's what we call an iterative process. So it just meaning that each time we need a new lens, we manufacture another. But what that means is when the doctor's making your lens, they're using a computer program with the model of the lens on it. And so they are pushing and pulling around different points on the lens. So they'll take the model of the lens you're currently wearing, whether it's a year old or 13 years old, that's in the computer. And they'll say, hey, since this lens 13 years ago, we need to move a couple of these points around. Now, 13 years is quite a long time. So they may start with the base set, or sometimes we'll just scan an eye and take that scan data and make a lens. After 13 years, maybe enough has changed to just start over, but they don't have to do that. The actual plastic lens, though, that is currently being used is replaced. It doesn't go back to the lab and get lathed again or anything like that.
Yeah. All right, well, thank you to all of our presenters tonight. Thank you, Kinney, for sharing your story and your experience with Sjogren's syndrome and the PROSE devices. As I mentioned, we will follow up with all of you within a few days with a recording of the webinar and answers to your questions. Thanks for joining us tonight.